Hi guys, so this is part 2 of my series, What's Holding You Back? So just to recap, I'm going to do a series of videos to help those people who are wanting an aesthetic treatment to help them feel more refreshed and rejuvenated. But there's something holding them back, they have worries and they have concerns. So I'm going to be addressing those over the next few weeks. Part 1 was how do I avoid you looking done, keeping you look fresh but not fake? So go back and check that one out if you've not seen it. And today I'm going to be doing addressing how I reduce any pain and how I make it more comfortable. We're obviously talking about Botox and dermal fillers, so it is with the needles. So this is what I'm going to be talking about today. So number 1 is that I use a numbing cream, so either LMX4 cream or Emla cream. They're both essentially the same. I will put this on as soon as we know we're doing a treatment, and it takes about 10 minutes to work and significantly reduces any discomfort that you'll feel with a needle. Number 2 is that I will also be using a filler brands, so both the Juvederm range and Teoxane range, they have a numbing cream in the filler itself already mixed in. So once it's actually in the skin, that will start to work, and that will also reduce kind of any tenderness, from the injection point onwards as well. Number 3 is down to my technique. So I use a really gentle technique. Often people will say to me that they couldn't feel the process at all and actually, feel like they could go to sleep. So I try to use a really gentle technique. And to do that, I leave plenty of time for my treatments. We are never rushed, and that helps me to make sure that everything is just really slowed down, really gentle, and that also is a huge contributor to your comfort levels. The other thing with that involved with technique is that I can use a cannula. So a cannula is a blunt tip device that we can use instead of a needle. In some areas, and I'll cover this in a later video, it can be a safer thing to use, but in terms of comfort, it helps because rather than doing multiple injection points, I can do one injection point, go in with this blunt tip device, and actually fill in large areas if necessary. So it does actually help with that as well, and that's something we can discuss. And probably the final thing, although I've probably missed some things, is about the consultation. So my consultation with you is really important. It's very, very important that you aren't really anxious when you sit down and have a treatment. So if as soon as you come in the room, I'm like, get down on the bed, we're going to start doing a treatment straight away, you're going to be wound up and you're more likely to feel discomfort. As I've said, I take about 45 minutes to an hour with everybody at the first consultation so that I can address any of your fears, any of your anxieties, so that by the time you sit down, you don't have those anxieties anymore. When we have the treatment, you should feel that you are in safe hands and feel relaxed and enjoy the process, because it's a real treat to have these things done. And I hope that you actually can then relax and enjoy and look forward to the actual outcome. To add to that, I put some music on of your choice. So it just is a really nice, relaxed atmosphere for you. There are probably other things, but I think that's probably enough. Final thing just to say is that, again, if you want me to address your specific worries, I will do a video just for you. I won't mention your name, but if you want to send me a message, I'd love to actually just be addressing your specific concerns, worries. So please send me a message via my bio. So the details are on there. You can give me a call if you want to, but sometimes it's a bit less scary to send that initial message, and then I can address some of these things for you. And please keep looking and keep watching these. I'm going to be doing them every week over the next few weeks to address something different each week. Okay, guys, have a nice week. See you soon. Bye-bye.